not about the private or the private against public or public against private. We're all nurses, you know, we're all in this together and we need to support each other.
Everybody should be entitled to receive health care, whether you can afford to pay for it or not.
That's going to put a lot of, pressure on the community when, you've got the elderly and the low economic families that won't be able to afford private. It's hard enough now for the people to get their operations done at a public hospital with the waiting times than to have to wait longer because they've got private beds in there as well.
And with the privatisation of the public hospitals, the nurses are not guaranteed their positions even, and then their conditions may not be honoured under the new agreement with the privatisation.
Our oldest son, he was 3 years old and needed to have his tonsils and adenoids and grommets done. In the public system, we had to wait nearly 2 to 3 years for that to happen, and we weren't in private health, had to pay over $1,000 to have him in just for one night in a private hospital.
There's always the budget that was keeping under the budget, and the amount of nurses we get's not adequate to provide the proper care that we need to give to our patients. We sort of look to the public for benchmarks, and so we're fighting for ratios at the moment, and if we don't have that background to support us, we'll have no chance of getting better care for our patients with better ratios. I went to the rally and I thought it was a good opportunity to take there was a lot of petitions going around, so I thought it was a good idea. I could take it to my workplace, and there's lots of people there that probably didn't know about the campaign, so I took that to work and got a few signatures for that.
Get out there and have a go and just tell as many people as you can to get on board, and if there's petitions going around, sign the petitions.
It shouldn't matter whether you work in a public hospital or a private hospital. We're all here to care for our patients and we work hard to do that.
We're not saying that we're against the delivery of private health care. We're against private operators delivering our public health system.